It is worrying because when you look at the range of mutations that it has, many of these are within what we call the spike protein, which is the protein that the virus uses to engage our cells to invade our system. And normally, the vaccines that we have are meant to target that spike protein, and the vaccines were made with a certain blueprint, which was the original strain of the virus. So now, as you have other viruses with accumulating number of mutations around the spike protein, what that means is that the protein may change sufficiently that is able to evade antibodies that our body has made or antibodies that vaccines have induced. And this could be a challenge because that will mean that the vaccine effectiveness would reduce. That means that if it used to protect 90%, may come down to 70 or whatever level. We're yet to find out. Yes, so that's the challenge. And also the fact that the numbers are increasing rapidly, that also should suggest that it has a growth advantage. In other words, it replicates better or faster than the existing virus. That's why it's able to increase in cases in a short time. Now, we have to wait and see because we've had other situations where a variant has emerged like that, but hasn't endured. So sometimes you can have a cluster of cases where they are all related in the sense that they went to the same function or they were exposed at the same time. So you have a sudden increase in the number of cases in a particular area. And it may not be that the virus is more transmissible, but it just could be that the people were exposed at the same time. So the numbers just increase rapidly.
So it's too soon. Is it too soon to be too worried?
Yeah, I think it's always good to take precautions, but I also don't think we should overly react. We need more data. We need to do our own sequencing over here and then get data from all the other countries where it has emerged or yet to emerge. And then we put it all together and see where it goes. But obviously, having so many mutations around the spike protein means that there could be trouble. But we have to follow the real evidence, the real world evidence.
The reactions then of Israel, among other countries, banning flights from South Africa or travel from South Africans, would you call that a knee-jerk reaction? Very quickly on that.
Yeah, not only is it knee-jerk, but it just doesn't work. The evidence shows that these variants, by the time we find them in one country, they're already in several places. Right. So are you going to ban all those countries? You see that every day there's the list of countries that it has been detected in is growing. So are you going to ban all those countries? And in any case, South Africa may just have detected it because they are doing aggressive genome sequencing. Many countries are not, especially in the lower middle income countries. So if you're not doing aggressive sequencing, you will not detect new variants when they come. So it doesn't mean that because they detected it, then that's the ground zero of the variant. Could be somewhere else that we're yet to find out. There are so many countries that don't do genome sequencing.
So to wrap the conversation with you, Prof, right before we come into the studio and wrap the entire thing up. So South African officials, for example, have said that Africa, we need support in terms of finances, in terms of public health, in terms of even the science in dealing with this new variant of COVID-19, Omicron. What do you expect to see in Ghana from our health service in the coming weeks? What are you expecting to see so that we, first of all, prevent Omicron from touching our shores, and if it does, that we can actually contain it?
Yeah, so I think the testing on arrival is a very important tool in our kit, and our work over the last year shows that because of the testing at the airport, it reduces the influx of new variants. So we have to make sure that is being done, meticulously, so that we are catching any people who are infected at the airport and isolating them appropriately so that if they are carrying these variants, we would know through the sequencing that will follow subsequently. And also that they wouldn't go and spread it into the community. So that is very important, that barrier of doing the testing on arrival. We have to really make sure that is tightened. And then we have to go back to, just following the protocols. It seems that in Ghana, whenever the cases go down, we all drop our guard and then we start living life like it's post-COVID.
Right.
So we have to, this has reminded us that COVID is not gone and it's not going anywhere soon. So we have to get back to following the protocols and living a responsible life once again. And then the vaccination, that's ultimately what can help in the biggest way, because if we can get sufficient vaccine coverage, then, not only would we be saving lives, but also we will be preventing the possible emergence of future variants, because the more transmission is ongoing, the higher the likelihood of new variants emerging.
Right.
So we have to ramp up the vaccination. Students are about to go to school. Perhaps we need to impose a mandate on students who are going to boarding house that they need to get vaccinated before they go into boarding house.
Right.
So these are things that we need to start putting into place as